Welcome to the Tech Connect podcast powered by PDi. This will be an ongoing series of informative information regarding technology and improvements in our industry. We'll be airing sessions the first Thursday of every month. Hello, thank you for joining us again. This is Glen Rocco with PDi Communications. Welcome to our podcast. This time we will be discussing smart TVs and the benefits to healthcare facilities. Hi, Kat. Welcome.
Hi, Glenn.
So the pandemic was hard on everyone, but none were harder hit than the frontline workers in healthcare. How are the frontline nurses coping and handling with those pressures now?
Yeah, thanks, Glenn. So, we're all so very grateful for our frontline workers. And as the marketing manager at PDi, I like to keep a pulse on what's happening in the healthcare industry and promote ways that PDi can help solve some of their pains. I do a lot of market research, and I'm going to get to some of those nursing satisfaction statistics here in a minute, but I just want to state that we've all certainly learned to use technology post-pandemic, right?
Sure.
I mean, who hasn't struggled with a Zoom call?
Yep.
And I know nurses and patients, myself included, we really appreciate the increased use of telehealth visits, and certainly the use of the digital signage in hospitals was really helpful for real-time communications updates, especially as conditions and restrictions changed much during COVID. And that's important. I believe communication and relevant information are keys to helping others. And I'm a person who likes to focus on the positives and to help others. I wanted to also mention, I know nowadays you're doing a lot more webinars with our customers and sharing PDi value props and information and ways they can use our patient engagement software. So I think the time is right. I think the time is now that many in healthcare are looking to seek new ways to transform how they deliver healthcare, what those clinical workflows look like, and maybe using a bedside smart TV technology can help them create more meaningful, deliver more meaningful content to their patients, the stuff that matters most for their patient populations. And I like to say, save nurses steps, walking and talking, saving steps, walking and talking. So let's take a look back and look at a few of the trends in that nursing satisfaction era of 2022. So we know there opportunity exists now to transform healthcare using technology to help achieve, they call it the quadruple aim nowadays, right? Reduce costs, improve patient satisfaction, improve health outcomes, patient outcomes, and certainly better satisfy nurses are included in that quadruple aim. So we're going to talk about developing a strategy to transform nursing practice and review the activities that nurses can do differently so that they can work smarter and, most importantly, perform at the top of their license. That's where they thrive, providing optimal care to improve patient outcomes. But first, we have to get to the good, the bad, and the ugly, right? So I've reviewed several data sets for nursing satisfaction studies. And the first is the Bureau of Labor Statistics, which published that RNs obviously are in high demand. Do you realize, Glenn, the U.S. labor statistics suggest a 6% growth in RN demand or need for the next 10 years? That's a decade worth of a strong demand for nurses, for the next 10 years. Our second data point was from the advisory board survey done in May of 2022. And that reflects 25% of nurses said the pandemic reduced their job satisfaction, and 20% are burned out. So we know nurses feel most rewarded making a difference in patients' lives, but one of the least rewarding is the patient-to-nurse ratio. It's just too high. And post-COVID, nurses are frustrated, they're stressed out, they're burned out, they're just simply exhausted. So the time is now to think differently and challenge the status quo. Look at new, smarter ways to use technology and evolve beyond that traditional care delivery to improve how you deliver redundant activities. Things like patient education, discharge planning and instructions or transfer instructions. There's a lot of opportunities, as we found post-COVID, where technology can help.
Yeah.
And I think people are more open to that idea now. My third data point is from the American Nurses Foundation, who also did a workplace study in 2022. So they report 31% of long-term care nurses reported being short-staffed. And wow, wait until you hear this. Over 60% don't have time for meals or breaks.
Wow.
I know that wouldn't, I couldn't function in that space. So when asked what the organization can do to increase nurses' job satisfaction, 68% said increase salaries, and 59% say bring on more nurses and support staff. But really, how realistic are those expectations?
Right.
Rather, maybe it's time to seek those meaningful technology solutions and invest in new technology where it makes sense to support the nursing activities using technology.
Sure. You mentioned earlier that PDi had a calculator tool to look at saving nurses steps. Obviously, saving time in their daily routine would be a huge benefit. It may not solve every problem, but how do you keep them from walking so many miles throughout a day?
Right. So interestingly, yes. In 2018, the NIH, the National Institute of Health, funded a time motion study on where and how nurses spend their time. And the findings indicate nurses spend most of their time, 35% in fact, in the patient room. This includes roughly 30 minutes every 4 hours with patients. And it was fairly consistent regardless of time frame. So the 7 a.m. to 11, the 11 to 3 p, and 3 p to 7. Those are the 12-hour periods that they studied. They also spend almost 10% of their time walking between patient rooms. So this consumes 20% of their day just walking and talking.
Yeah.
So again, we know nurses feel valued when they feel like they're making a difference, improving patient lives and are helpful to their patients and families. And they want to perform at the top of their license to help improve the quality of patient outcomes. We know the goal of nursing is to provide efficient patient care and cost effective, but that might mean it's time to delegate or find new ways to do things. So we created this online calculator. It's a free tool, and we'll share a link at the end of this podcast to that tool. But you only need 3 pieces of information to run through this calculation. You need to know the number of beds at your facility, the number of nurses by role, and what state your facility is located in. And it's very simple, and the tool will do the rest, and it will churn through the return on investing in a cloud-based patient engagement software platform to provide that quality of care and use technology for those redundant activities that nurses are performing. And it helps you find those hidden costs in especially walking between patient rooms.
Yeah, that sounds awesome and like a great tool to help people understand what they might know but might not be able to put into words or cost. As we come out of the pandemic and we attempt to get back to a new normal, what other improvements have been brought to the forefront that facilities can implement economically without a large upfront capital investment?
Right. The industry needs something that's simple, easy to implement, it's affordable, a technology strategy or plan to make nurses happy. Because we know they're so frustrated and stressed out. So we want them to be able to focus on providing higher levels of care and reduce those redundancies. And actually, with all of the demos that you do, Glenn, maybe you're the best one to speak to and share some examples on ways that facilities can benefit from using our Genio platform, our cloud-based software on PDi hospital TVs, to help them deliver better quality of care using technology. Could you share a few examples?
Yeah, so our demos have been great. Webinars have been a great solution, keeps us engaged with facilities throughout a variety, whether it's facilities maintenance, but we often get nursing involved. And what we find is when we ask questions of, how do you do these things today, many times they don't have answers for it or they're not doing it. So we bring to the forefront surveys that they can conduct of their patients while they're still in the facility, maybe get results that they can act upon before they're discharged, before they go home and take that Press Ganey survey that's ultimately very impactful to the facility. Also messaging. So if you have a patient who might be a little more troublesome, let's say, or a little more higher maintenance, you can send them messages without having to walk down the hallway or without having to interact with them or stop in their room for, again, you mentioned redundancies. So you can send them a message of, your test is coming up or your doctor will be here in 20 minutes. It's not a way to push off care, but it's a way to keep those patients from constantly pressing the nurse call button of, I need to know, I want to know, or when can this?
Right. Information is power,
absolutely.
and we want those patients to feel empowered.
Yeah.
So that's great. The messages can just appear on their bedside display,
Absolutely.
bedside television.
Yep. From the nurse's station, they can easily select their individual room TV and type in a message and send. And we're talking, 10 seconds to deliver a message. Pops up on the patient's screen. It doesn't take away their television or their games or their internet access. It just pops up a bright screen in the middle, and then there's a clear dismiss button that they can dismiss the message and move on with their activity. But again, engaging them, keeping them informed.
I remember one of the demos you came out with, and the facility actually loved that idea. I think it was a long-term care where they could push out a message that the fire alarm was going to be tested.
Absolutely. That was something I thought was going to be very blasé and just a quick little passover on. They ate it up. They talked to other people. It's great when you're doing a webinar or a demo and they start chatting amongst themselves and hey, I kind of hit a nerve. Let's just let that flow. And ultimately they did, and they came back and said, you cannot believe how much time that will save. Just by us pushing out that one message to 40, 50 rooms and not having to go from room to room to room and then get distracted or bogged down, let's say, with other hey, while you're here, can I ask you this type of questions? Mm-hmm. Again, nobody's ignoring the resident or the patient in the setting. They're just trying to do their daily tasks without becoming burdened. So multiple facilities, and now I run that into all of my demos. Multiple facilities have really caught on to, oh my goodness, I could do this facility-wide with one quick message and hit send. And yeah, absolutely.
Yeah,
so
a nice time saving. Can you also only send a particular survey question to certain displays, certain patient rooms?
We can do it into individual patients that maybe, let's say they replaced an ice maker in a hallway and there was a complaints of noise, and we can look at rooms 2 to 3 units down the hallway and send only to that area. We can also send to entire departments. Let's say you want to get feedback from labor and delivery, and that's a really important part of your facility. It's a big moneymaker facility. You want to keep them happy. So we can target departments, individuals, a block, or entire campuses if they want to simultaneously. The information can be charted, documented. They can look at meaningful improvements that they implemented a task or a feature, and they want to see does that improve their patient satisfaction over a block or a period of time. Very easy to implement.
Right. And I know you mentioned labor and delivery, and certainly patient education or education
Absolutely.
is a critical thing. How can they leverage the Genio software to deliver consistent patient education?
Sure. So obviously in a healthcare setting, you would have different education in labor and delivery than you would have, let's say, in pediatrics. Obviously, you don't want those two to overlap. So we can have a very discrete area for labor and delivery. All the TVs in that unit are categorized under that department, and then task over there of maybe breastfeeding or how to care for the umbilical cord. New parents have these fears of, hey, this kid didn't come with a book. How do I know what to do? This is a great opportunity to educate them, to inform them, and give them the tools that they need when they go home and they're not in your facility any longer.
Great. So, and what actions are needed now? I feel like we're at the stage where nursing needs to really think differently. People in healthcare need to think differently to address the dissatisfaction that exists, because we know the demand is strong. It's huge, as I reported early on. And certainly, mental health is important. Mental health awareness is is out there, and nurses are part of that.
Yeah.
So that's certainly another topic. But it's not feasible to be able to maintain the level of expense for things like travel nurses or the sign-on bonuses. I know in 2021, Texas, they bumped up their sign-on bonuses for nurses from over $5,000 to over $10,000. And 3 out of 5 offers had bonuses, sign-on bonuses, versus 1 out of 5 the year before. So that's just not a financially feasible alternative. So we have to start thinking differently at how we can engage nurses to improve their workflows, make them more efficient, make them more happy, but we need to involve them, I think, in decision making now. We need to consider, are there ways that we can leverage technology? Just like we've all benefited post-COVID from Zoom calls and telehealth visits. The audience, the patients are adapting, right? We're all adapting to real-time streaming services and real-time information. So it's time to start considering these smart, affordable bedside TV solutions to help them perform their jobs more efficiently, let them perform at the higher quality levels of care at the top of their license, and help make nurses happy again.
Yeah.
So
you've said top of license a few times, and that really resonates. They didn't go to school to pass ice cubes or to go and answer questions about when somebody's going to be here to see them. They need that satisfaction and need to know that their investment in their career is beneficial, and
Right.
and they love to care for patients.
Right. I'd be happy to continue the conversation.
Thank you. That'll be all for our Tech Connect at this time. Thank you for joining. Thank you for assisting us, Kat, and really appreciate your time.
Thank you, Glen.